Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Today, more anxiety over COVID-19 in Nigeria as virus passes 5,000 mark and medical practitioners call for more testing coordination. Presidents, prime ministers call for people's vaccine free to all. And the World Health Organization warns against the likelihood of the coronavirus staying with the United States for some time. The coronavirus crisis has shown that healthcare is an important right for all. This pandemic has brought all health institutions testing its capacities, testing its workers, testing each country's government. While other continents are hit with high figures, Africa is witnessing increasing figures. According to the World Health Organization, there has been a 42% increase in the number of confirmed cases of COVID-19 in the African region in the past week. The West African region is most affected, accounting for 43% of cases. Countries like South Africa, Algeria, Ghana, Nigeria, Cameroon, Guinea, Senegal, Cote d'Ivoire and the DRC are most affected by COVID-19 in the African region. And this is in terms of cumulative case numbers. Together, they account for 87% of reported cases. Now, as Nigeria crosses the 5,000 mark on our theme this afternoon, we analyze the implication for our theming population. The Nigeria Center for Disease Control, NCDC, has confirmed 193 new cases of COVID-19 in the country, bringing the total number of cases to 5,162. It also puts the number of patients discharged at 1,180 and deaths at 167. The new cases were confirmed in 14 states and the Federal Capital Territory, 58 of them in Lagos, 46 in Kano, 35 in Jigawa, 12 in Yobe, 9 in the FCT, 7 in Ogun, 5 in Plateau, 5 in Gombe, 4 in Imo, 3 each in Edo, Kwara and Benue states, while 1 each in Bauchi, Nasarawa and Ondo states. The figures by region shows that Lagos in the southwest still maintains the epicenter there and also in the country with 2,099 cases, followed by Kano in the northwest with 753. The FCT in the north central comes next with 379 cases and Bauchi leads in the northeast with 207 cases. Edo State still tops in the south-south with 92 cases, Enugu in the southeast with 12 confirmed cases. More than 140 world leaders and notable figures have signed an open letter requesting governments to unite behind a people's vaccine against COVID-19, marking the most ambitious position yet set out by world leaders on what has become the most urgent quest in modern science. Well, according to the petition, when a COVID-19 vaccine is found, they say it must be the people's vaccine available to all people in all countries free of charge. They're demanding that all vaccines, treatments and tests be patent-free, mass-produced and distributed fairly. Also a position the South African government is especially pushing for scientific research to be shared between countries, while the Prime Minister of Pakistan underscored the need to put all the knowledge, experience and resources at the disposal of all. Other signatories include former Nigerian President Olusegun Obasanjo, former Liberian President Ellen Johnson Sirleaf, former Prime Minister of the United Kingdom Gordon Brown, former President of Mexico, former Prime Minister of New Zealand, amongst others. A professor of biotechnology in the Department of Plant Science and Biotechnology in the Faculty of Natural Science at the University of Jos, this Professor Chike Gbonna, his laying claims to have found a solution to the coronavirus pandemic. In his claims, the professor asserts that his research, alongside other professionals into Artemisia annua plants and subsequent discoveries of the components and levels and the derivatives are the result of a probable solution to COVID-19, having used the same plant components in the treatment of malaria and for diabetic patients, which he says he has a patent right in that regard. Well, let's now bring you the latest from our correspondent in Benue. He reports from the Makurdi state capital with regards to the efforts at curbing the pandemic.
Results from the sample collected from 15 passengers, including the Lagos escapee who is allegedly positive COVID-19, are in the state as we speak. The Commissioner for Health has just said that they are sorting out the results and make them public. Recall that one escapee was alleged to have left Lagos for Benue State, and he was intercepted alongside 14 other passengers and kept in the Otukpo isolation center, while the other 14 passengers who were Boko bound were taken to Boko for isolation. As we speak, any moment from now, we should get the result from those samples taken. On the confirmed cases in Benue, we have 4 confirmed cases, and about 50 contacts are being traced, people who may have come in contact with them for self-isolation. As we also speak, the State Action Committee has distributed palliative materials to the zonal headquarters of the 3 senatorial districts. And today, a decision will be taken on when to distribute these items to the vulnerable and poor families across the 23 local governments of the state. But what the committee is saying to Benue people is, ensure you observe social distancing, avoid crowded places, wash your hand with running water and soap, as well as the use of alcohol-based hand sanitizer, so that we can contain the spread and manage the disease as much as we can. From Makurdi, the Benue State capital, Pius Angbo reporting for Channels Television News.
Thank you, Pius. Let's now dissect the rise in cases. And we have here in Lagos, Dr. Sunday Luro, a medical practitioner, also the past secretary, Nigerian Medical Association, Lagos. Thank you for joining us.
Thanks for having me here.
And from Indiana, Dr. Abdulaziz Bako, a PhD candidate, Health Policy and Management, Indiana University, joins us via Skype. Glad to have you.
Thank you for having me.
All right, let's begin with you, Dr. Bako. Tell us about the restrictions, especially where you are, and perhaps if there is an ease and all of those efforts to stemming the pandemic in the United States.
So we are at the stage where a lot of states are easing restrictions on movement and the restrictions that are supposed to increase social distancing. For example, in Indiana, where I am, the restrictions to movement have been lifted in many areas, particularly the non-essential businesses are allowed to be open with some strict regulations. Religious places are allowed also to be open. A lot of the restrictions that were in place were lifted, but that was made possible after a lot of studies that were conducted to get to know the extent of the infection in the state.
All right, tell us about, we're hearing from The Guardian reporting that some people are using the virus as a weapon. Several reports like a Michigan man who wiped his nose and face on the shirt of a store employee who was actually trying to enforce the use of wearing a face mask. Also, Florida, a man coughed and spat on police and threatened to spread the virus. Some of these people have been arrested, and also another person in Texas. Do you think that the virus is being used as a weapon against police, retail clerks, and all of these people who are trying to ensure that it doesn't spread?
It is very possible for people to use this virus as a biological weapon, especially for people who know they're infected and they are asymptomatic, and maybe they have some kind of other motives to spread kind of hate or do some hate crimes. But that's something that, as I mentioned, is possible. In London, I have seen the news of a Congolese woman that was killed or died as a result of COVID-19 after she was being spat on by a person. And I think this is something that governments need to work really hard on to prevent.
Lagos here, Dr. Luro, you're saying that we're passing the 5,000 mark. Lagos is still the epicenter. What's your observation as to health workers, especially in Lagos, and how they're faring?
Uh, to start with, it is unfortunate that we are here again, having passed through this kind of experience in the past, even though the magnitude, it is far less than this. I am referring to the issue of Ebola virus. It is expected that when you have such a situation, you want to plan ahead. You want to consolidate, especially when you have recorded some level of success. Unfortunately, again, we didn't take the advantage of the success of the Ebola epidemic, the war against Ebola. We won clearly, but we didn't consolidate. What this translates to is this. That means that in terms of preparedness and response, we to a certain extent, relaxed. We didn't build up on those gains. So therefore, when you have a situation like this, it is the health workforce and the entire citizen that will be at the receiving end.
But in this fight against this pandemic, what would you say the biggest challenge is?
The biggest challenge in this for health workers, it is the issue of the availability of protective tools, the so-called PPEs, the personal protective equipment. Unfortunately, again, even prior to this moment, we have issue with the standard precautionary measure because we do not even have the basic. Most times, they are not enough to even be able to observe those standard infection prevention and control measures. So now coming back to the era of COVID-19, you require some level of upgrading, so to say. So meaning that those basic tools that is generally on a routine basis, when I'm attending to a patient or a nurse is seeing a patient, supposed to be wearing gloves or observe other measures. Those ones were not enough. Now, you now have a COVID that you require some level of sophistication. You need things like suits. You even need things like face masks, the common surgical or medical face masks. They are not enough. Everybody is running out of scope. But prior to this, we do not even have them in that sufficient level. So therefore, it increases the risk of health workers contracting this infection.
We'll come back to you with regards to some of the things that we need to be doing. But let's go back to Dr. Bako, and that is, do you see Africa as the next epicenter of coronavirus with projections and studies, even a few of the things that the World Health Organization is saying, seeing as, you know, our numbers are increasing and Nigeria passing the 5,000 mark?
Yes, we are at the stage where, the number of cases are increasing at an accelerating rate. And I think governments in Africa, that's what they should be looking at. They should be watching out for the doubling time of their disease. For example, in Nigeria, we had roughly about 1,000 cases around April 24th, and that increased to about 2,000 by April 30th. That's a doubling time of about 6 days. So we should be watching out for that kind of doubling time. How many days does it take for the number of cases to double? Another thing that we need to look at also is the mortality rate. How is our mortality rate changing? Because as the healthcare system is being filled to capacity, the number of deaths will continue increasing. And those are the kinds of things that we need to be on the watch out for. And, also look at other things such as the personal protective equipment for health workers that my colleague has mentioned, and other, measures that would increase testing capacity across states.
All right, finally to you, Dr. Luro, what do you want the government to be doing, Lagos State, the federal government, to ensure that we can fight this?
I think the first thing is communication. As it is today, we have done so well, especially considering the effort of NCDC and the Presidential Task Force. Also in Lagos State, the EOC and the incident commander, His Excellency, everybody is doing fine. However, we have to move further. The issue of risk communication and community engagement. Because you will see, if in your neighborhood, you see people hanging face masks, they're not wearing it properly. And most people, they are not even convinced that this thing exists. So what it means is that we have to involve very critically people at the community level, like estate association, landlord association, and the rest. Aside that, we have to also strengthen collaboration. Thank God today, as of yesterday, the federal government has now incorporated the Professional Health Association into the fight.
So essentially all of the stakeholders.
All of the stakeholders.
All right.
Then you also have to ensure cooperation, because there's nothing you are going to achieve if you don't have intersectorial.
We'll definitely keep talking about this, but I wish we had more time. We would like to thank you for joining us, Dr. Sunday Lero, medical practitioner and past secretary NMA Lagos, and also Dr. Abdulaziz Barko, PhD candidate, health policy and management in the US. Thank you for joining us.
Thank you for having us.
So to comment our COVID-19 update, life returns to normal or the new normal around the world with lockdown measures easing. We have that story and more when we return. And from across the state, fumigation exercise is beginning in Gombe State. It kicked off at Amada Quarantine Facility under the Gombe State Ministry of Environment. The exercise is expected to be taken to hospitals, markets, and other places where people converge. Dr. Hassana Goje, Commissioner for Environment, says the primary mandate of her ministry is to ensure the well-being of the environment and that chemicals used for the exercise have been tested to be environmentally friendly and harmless on the people. According to the government, the task force is working round the clock to fight the disease to a standstill. In Kaduna State, the government has deployed its senior political appointees to supervise the enforcement of interstate travel ban at all entry points and borders across the state. Also, 35 more COVID-19 patients, all of them Marjorie, have been discharged by the Kaduna State Ministry of Health after testing negative twice. The Commissioner for Health also said Kaduna State now has 47 active COVID-19 cases with a total of 63 persons discharged and 4 deaths recorded. Anambra State Governor Willie Obiano has appealed to the people of the state not to panic as he announced a new case of COVID-19 in the state. In a briefing at Aguleri, Anambra East local government area, the governor disclosed that the new case returned from Kano the 6th of May after a short business trip. The governor reveals that the case is receiving treatment at one of the protective care centers, reassuring the aggressive contact tracing has begun to minimize the wave of community spread. The governor also warns that movement into Anambra State by groups or individuals is no longer allowed, directing the security agencies to ensure the enforcement of the 8 p.m. to 6 a.m. curfew in the state. And in Ekiti State, the government has extended its COVID-19 palliative gesture to pensioners. In the wake of the lockdown in the state, the pensioners had asked the state government to factor them into the palliative arrangement, as the current situation has also rendered them vulnerable. The state government sent 1,000 packs of food items to the pensioners to ameliorate their suffering, and it will be distributed to the most vulnerable pensioners who are 80 years and above. Well, we continue now talking about, indeed, ways that we can stem the tide of the pandemic. And joining us via Skype from Berlin is a DW, Deutsche Welle correspondent, Rob Watts. He joins us from Berlin. Hello, Rob. Please tell us about this pandemic, how it's affecting the lockdown ease, rather, and how that is affecting the rate of infections in Germany.
Yeah, well, Germany is slowly making its way back to normality with every 3 or 4 days. Something changes just to bring us a little bit closer to what we had before the coronavirus outbreak. For example, today here in Berlin, the restaurants are opening for the first time. Also, we have restrictions in place, but you can now go into shops, which you couldn't do for a long time here in Germany and Berlin, but you need to wear a mask. And if you want to go on public transport, you also need to wear a mask. The effect on the rate of infection is something that's been very closely watched here in Germany, because Comparatively, when compared with other parts of Western Europe, Germany's death rate is quite low. The key figure people have been looking at is this R number, which is the number of people that the average person who gets COVID-19 infects. The key is to keep it below 1, which was the case before Germany started loosening the lockdown. Then we had 3 days earlier this week where it rose above 1, which is seen as a very bad thing. However, it has slipped back below 1 again now, and people are feeling a little bit more confident.
We also understand, Rob, that the first major league in Europe, the Bundesliga, is restarting this weekend, although we hear empty stadiums. But are there any concerns? And some people are asking, isn't it too early?
Well, there are concerns that it's too early. As you mentioned, it's the first major league in Europe to start, the first major soccer league to restart around the world. There are concerns among the players, for example, that they can't necessarily be kept safe enough. Some of them have said that they are worried about playing, particularly those that have got relations who perhaps have pre-existing conditions that make them vulnerable to coronavirus. But the Football League and the government here seem confident that the Bundesliga can restart safely. Now, there has been a scare, 1 or 2 scares. Most recently, last week, 2 players for the second division club, Dynamo Dresden, tested positive for coronavirus. So the entire club had to be quarantined and their match postponed. So there have already been some setbacks, but there's a real push to get this going because Germany is football mad for a start. It's a big morale boost, but also the clubs are losing out on a lot of money. And the top 2 divisions, it's thought that maybe a third of the clubs could be in real dire financial straits if the league continues to be suspended.
But are there any concerns that fans may gather outside stadiums, for example, during the matches?
Yeah, there are concerns about that. It happened actually during the last game that was played to an empty stadium. It was Mönchengladbach against Cologne in early March, just before the lockdown kicked in. Hundreds of fans gathered outside, and that is sort of the worst case scenarios, the worst thing that could possibly happen, really, in terms of fan behaviour in relation to the matches that we're getting this weekend. Police are urging fans to stay away, stay at home, watch it from the comfort of your own flat, because we can't have people coming together, potentially spreading the disease. So that the restart of the Bundesliga is actually bad for the entire population, not just for the people who are directly involved, like the players.
Thank you so much, Rob Watts, there, DW correspondent. Thank you for talking to us.
Pleasure.
Now, the US might be heading for the darkest winter in modern history. That's according to a former top health official, Rick Bright, who says he was ousted from his job after refusing to promote an untested drug treatment being touted as a game changer by President Trump. A total of 85,807 people have now died with the coronavirus in the United States. Over 4.4 million cases of COVID-19 has been confirmed in the world, according to the Johns Hopkins University statistics. Of that figure, over 300,000 people have died, but over 1.5 million people have recovered. Here's our global update. Okay, I'm told that update will come your way a little later on today. But indeed, take responsibility in protecting your health. That's the NCDC message for you. It says the virus that causes COVID-19 can spread by touching a contaminated surface, touching your face. So while in public places, avoid touching door handles, stair rails as much as possible. From the World Health Organization, physical distancing is one of the most effective methods to limit the spread of COVID-19. The website has rolling updates on the pandemic and strategies and plans. Of course, each moment it's being updated. That's our COVID-19 update program at this time. Another update comes your way again at 6 p.m. and then again at 9 p.m. In the meantime, for the latest update, our website, channelstv.com, has the latest information that you need. I'm Millicent Wonga. Bye for now.